thank you all for coming. It's really an honor for me to have Dr. Singer with us. I just want to mention that CCARE is sponsoring this. Do any of you or all of you know CCARE? How many of you come to events? All right. As you know, we do a lot of things. One of them, of course, is research. The other thing is really promoting this concept of compassion in a variety of venues all over the world. And the other thing I think that's wonderful is that we've developed a number of programs. One was compassion cultivation training. More recently, we've just started a program called Cultivating the Heart. And then we now have a program called Applied Compassion Training, which is an 11-month-long certificate program where, if you will, we create ambassadors of compassion. And what I mean by that is that these are individuals from corporations, from healthcare environments, people, if you want to call it the mind, body, spirit space, and they have to do a capstone project, and we mentor them on the development of that project. And then they implement it when they go back to their location. And I'm happy to say that I think we have had representatives from over 60 countries. So it shows you the global nature. And in some ways, actually, the thirst and desire to connect with that part within yourself, not only to learn how to be more self-compassionate, but also how to be compassionate to others. And to understand that on some level, everyone is suffering. And I think, though, before you can get there, one of the important things is you have to be kind to yourself. And certainly in Western society, for many people, that is an ongoing issue. So unfortunately, I do not have a photographic memory, although I've tried and failed miserably. So I want to introduce Dr. Singer, and she's graced us with her presence here before, so I'm very honored she is back with us. She is the scientific head of the Social Neuroscience Lab at the Max Planck Society in Berlin. She did her PhD in psychology at the Max Planck Institute. So you'll probably repeatedly hear Max Planck Institute. Apparently it's the only institution in Germany. So anyway, she got her PhD at the Max Planck Institute for Human Development in Berlin. And then she did a postdoctoral fellowship, not only at the same institution, but also was at the Wellcome Department of Imaging Neuroscience, as well as the Institute for Cognitive Neuroscience in London. She became initially an assistant professor and then the inaugural chair of the Social Neuroscience and Neuro-economics department and co-director of the Laboratory for Social and Neurosystems Research at the University of Zurich. And then between 2010 and 2018, she was director of the Department of Social Neurosciences at the Max Planck Institute.
It's another one.
Yes.
Yeah, you have to know there are many. It's like Harvard, MIT, and they just all called Max Planck Institute.
Yeah, right. A very powerful man, Max Planck. She's obviously a prolific author, publishing over 150 papers in peer-reviewed journals. And she also actually has written a number of book chapters, but also edited a book with Meng-Wu. I don't know if any of you know Meng-Wu. He's a good friend of both of ours and also has been here at Stanford a few times on caring economics and the power and care. So the talk today, which you can read right here, is From Interchange Towards a More Caring Economy, the Neuroscience of Motivation, Caring, and Compassion. I just want to say also, one of the reasons that this talk excites me is that we look at what's happening in the world, and whether any of us like it or not, the people who control the world are the people who control the economy, right? And this has a huge impact. You know, there's a saying that Tolstoy had, I don't know if any of you have heard it, it's, there's a man on your back choking you, He acknowledges he's on your back choking you, but never does he offer to get off your back and stop choking you. And unfortunately, these vested interests oftentimes are all for doing change as long as the change has no impact on them. And I think we're at a time in our society where this is no longer acceptable. You know, I don't have to point out the power of the billionaire class to highly influence what's going on. And sadly, it's almost a joke for some of them, right? Where they manipulate things, they say things, and it's very, very powerful. So I think in some ways, hopefully we, and I think Tania will speak about some of this, look at the economy in a different way and the possibilities of how that different look can change everything. So without further ado, thank you for coming, Tania.
Thank you, James. Indeed, I remember the last time I spoke for CCARE was actually at the inaugurational meeting when it was just born.
Yes.
So that's nice, like a full circle, right?
And I have to say, you look even younger now than that.
How charming. Yeah, so thank you so much for having me here. And I'm really thrilled. And yes, thank you for finding us here in this venue. So I brought you quite a lot of things. So I think we have a good hour or so together. And so as you know, James said, we will talk a bit about caring economics. I'm not an economist. I'm a psychologist and neuroscientist. So I'm really giving you a psychology neuroscience view on economics and not an economic view. And I will also want to challenge these more, classical economic views by showing you a lot of psychological and neuroscientific data, which actually prove these models wrong. And just prove that this is not how human beings are, and that we actually should remodel all our assumption of homo economicus. Not we, but like this should be macroeconomists doing it, and who knows math better than me. But I just want to show you data of how we can, what the economists call social preferences, whether you're an egoist or an altruist, that you can actually change that through mental training quite quickly. And then this is my, real passion, and where I'm really, doing my research since 20 years is on mental training and how to change actually our mind, our attitudes, and our, the care system. So I will talk about this 1-year longitudinal resource project, which is not like an experiment, but a lifelong project, right? I started it in 2008, still publishing. We have like 60 papers out. And so it's really like, it's like a child, which you see growing up and then becoming puberty and then going off the house. And then I you can't really understand the resource project without understanding the backbone of the difference between empathy, empathic distress, compassion, and how to move from one into the other. So I will also talk about that, because I think it's a very important topic for our present days, where so many people suffer, right? So many people are exposed to suffering every day, whether healthcare provider, whether refugee helping. I'm coming from Berlin, we have a war. Thousands of Ukrainian refugees arriving on our doormats every day in trains at the main station. So we have lots of problems to solve, right? And so then I want to show you how these mental training can actually change plasticity, reduce stress, make you healthier, and then show how we can scale that. That's the most recent work, unpublished data, which just come fresh out of the pipeline. And it's a study I did in the COVID pandemic time on mental health in Berlin throughout the lockdowns. And then we didn't even track the mental health and resilience over the 2 years, right? But also, can we help? Can we do something about it in reducing stress and reducing loneliness, reconnecting people through, digital practices? So I will show you that, and it worked, or it seemed that it worked. So very excited about that. So let me start with the caring economics approach. So how did it come that a psychologist and neuroscientist starting to think about economic models, right? I would never have thought in my life, and my parents certainly neither, that I would have to do with economists and economic theory. But because I was researching the neuronal basis of cooperation. So I was at the birth hour of neuroeconomics. I met Ernst Fehr, who is a very famous microeconomist, and he's in Zurich. And he asked me to join his network, which was an interdisciplinary network, wanting to understand the conditions for cooperation to foster or to break down, right? And so I was professor in an economy department as a psychologist and neuroscientist, having studied empathy and compassion. And so that was quite new. So I had to, in a way, learn all these ideas and models they were tweeting every day. And actually, I thought that was much more interesting than I thought, because I realized very quickly how powerful economic models are for all our system we are living in, whether education, healthcare, and that they really are the backbone on what we are standing, our culture is standing, right? So I like what you said, right? If we want to change something, we need to understand the backbone. And very often, we of course don't really know the formula or the mathematical formula behind, but they have implication on how we think, from education to, so this is what I will talk about. And Dennis Noor became my long year, he's a macroeconomist, and he was the president of the Institute of Global Economics in Kiel. Now he's in London, Oxford, and so on. And he heard me talking at the World Economic Forum and said, oh my God, Tania, if that's true, that it was early resource findings, if you can change human preferences so quickly just through mental training, we have to revise all our formula, all our models. I'm like, okay, let's try, let's get together. And then it took years to understand each other's languages, right? So what we tried is to actually use psychology knowledge and neuroscience knowledge and also behavioral economics to really inform new models of economic thinking. So that's a cartoon, right? So everyone who is economically gifted here, don't think that this is like, it's a reductionist cartoon, but you could say that financial interaction in the neoclassicistic modeling thinks about people having fixed preferences. It's like, if you, on one day, you prefer grapes over melon, you will also prefer grapes over melon on the second day, and morning and night, and when you are like 3-year-old or like 60, right? So these preferences are context-insensitive, they are time independent, they are endogenous giving, meaning they come from nowhere and are there, right? They are more or less fixed. So, and then you have these beliefs, these cognitive beliefs about the other, which can be updated through watching the actual action of someone. Now, in neuroscience, we know that it's very, very different, that humans are really very, very differently interaction. And that's, again, just a sketch, right? But we have the notion that context sensitive, like depending on in which concept you are, you have a different motivational system which becomes activated. And then this system, depending also on your information processing, your attribution, and all kind of things which works in your brain, will decide which decision you take, right? So you can imagine already there is not just one preference. There are many different motivational systems which can be activated in seconds and in minutes, and then have a totally different outcome in terms of decision making. So if we talk about motivational system, what do we mean? There is both in biology a lot of talk about motivational system, and in psychology it's since there was a longer tradition, and there are, as it is in psychology, right? There's no agreement about how many we have. They're like between 3 to 120, depending on who has published the paper and which method was used. But we have done a really 100-paper research and overview, and we came up identifying some of the main really important ones for decision making and for what we are talking about here. So, and Paul Gilbert, who is also a dear colleague of mine, he is also using similar categories of motivation psychology. So this incentive focus would be like achievement, right? You want to excel, you want to achieve. We wouldn't have sport without that. Then consumption is something we added because that is known in biology, not so much in psychology, but is the foundation of the utility function of economics. So it's really the utility function the economics know. It's you want to consume more goods, right? You want to optimize your goods and so on. And then you have power or status motivation, which are known in biology and economics and in psychology. You want to, and then this is complex. Power can be, power over someone, like, ranking, but it can, of course, be empowerment. It can be the power of just agency, and then it's actually a good thing. So we organized a whole conference with the Dalai Lama and Mathieu Ricard on the balance between power and care and how that should be balanced to be a good thing, right? So there's a book on it too. So another category of motivational system we share with all animals is threat focus, right? And anger and fear are just two expressions of our system being under threat. And then there is the socially focused motivation, and they are a little bit forgotten in our systems, right? The one is affiliation and the other is care. And psychologists speak mostly about affiliation, and biologists have more knowledge about care, interestingly enough. And when I work on compassion, I'm actually working on care more than affiliation. So affiliation, the subtle difference is that I want to belong to a group, right? This is like, I want to be part of a group identity, in-group, out-group. So I want to be liked. I want to be that people like. So it also motivates normative behavior, right? I want to dress like my group. I want to speak like my group. And it comes with the fear that I could be excluded, right? Excluded ostracism is one of the biggest fears of humans. So it always comes with a dark side as well, right? That if you're excluded, you suffer and you have pain. Care is really a totally altruistic motivation. It's really about the other. It's really about the welfare of the other. And it's probably evolutionary coming out, of mother-child bonding or father-child bonding. And really like, a mother would throw herself under a car if the child is in danger without thinking a lot. Is that my utility? Is that a rational thing to do? Well, I have something about it and so on. So the care system is really what I will talk mostly today about it. And it's something which has been absolutely neglected in most of our big macro system, even though in healthcare, the word care is in it, right? It's healthcare, but where is the care in healthcare? And same for education. So just for you to get a better feeling on this motivational system, this incentive focus, they come very often with high arousal, with wanting, impatience, excitement, drive, high arousal. So none of these motivation systems are bad, right? They all have evolutionary purpose. They are good in a certain niche and in a certain context. They just become dangerous if they are chronically activated, no matter in which context you are, even if it's not appropriate, right? So if you're constantly, like achievement, you will get exhausted and you burn out at some point. If you are like very, very status oriented, you have a lot of envy, of social comparison. And then the thing is that the sweat system is constantly activated if you are too consumption motive, because you're constantly afraid you will lose it, right? And I think we talked once, the greediness of millionaire, that's an amazing topic, right? A lot of people have confirmed that to me. They are milliardaires and still greedy, and on the cent level, right, and your level. So this is because it's always about more. So it's an addictive loop, and in neuroscience, it's associated to the dopamine system. It doesn't know absolute values, but only relative values. I want more, right? More than before, no matter whether the absolute value might say it's all enough, right? And that's this incentive-like driven thing, which can become very quickly addictive. And this is why these systems, like whether it's consumption, we have the problem of obesity in our society. We have the problem of workaholism, of internet addiction, of attention economy, right? And all these problems are hooked in these incentive-focused motivation, all these culture problems. And then, because you're constantly afraid not to be the best, right? And I mean, like just from a normal distribution, you can't be the best. Someone needs to be in the middle, someone, not every day. So, but because you want to be the best, you are constantly threatened. So then the threat system is chronically activated, and that gives disease, right? It gives burnout, it gives stress, it gives exhaustion. Now, this other socially focused system comes more with attributes like soothing and calming down the organism, especially care, right? Safety.
Hello.
Hello. Connectedness, so that it's an antidote to this very high arousal system. Yeah. And so it has a balancing function in our system, right? It can balance out this hyper excitement or this being hyper arousal. So I just said already, even though you don't have a one-to-one mapping of all these higher level psych constructs to neurotransmitter, you can still associate these incentive focus to a more mesolimbic reward system, which can become addictive, right? The threat system is associated, if chronically activated, to an HPH axis deregulation and too much cortisol, either too much or too little, but a deregulation of a stress response. And especially the CARE system comes with a system of oxytocin, opioid, also dopamine. They are like complexly intertwined. But we have a lot of evidence that if you activate CARE, you have pain analgesia, for example. And also if you activate, if oxytocin is, like more in the brain, activated in the brain, it actually inhibits the threat system. So it has an anxiolytic function on the amygdala, which inhibits fear and threat. So you could think of this CARE system being an antidote to threat and to stress, right? And so the question we had is, okay, can we rebalance this out of balance system, right? Both on a micro level within an organism and on a macro level when you look at the systems we have created, whether it's education, healthcare, finance system, which are mostly activating incentive-focused motivation, whether it's achievement in science, it's all about that, right? I think in finance, it's a lot about consumption more and status and power, in politics as well. So you can analyze our system we are living in what motivational system they're mostly activating when you're in them, right? And we have somehow banned our CARE system to the private life, right? We are allowed to love our children and our husband, and when we come home, the stockbroker can become super cute and very nice with his child, and but 2 hours before he was just like going over, you say in Germany, over dead bodies, right? Because they were in another context and there was another motivation activated, and that can switch. And so the question is, how can we bring CARE back in our official systems and not just ban it to the private life, where it's okay to be like that, but it's not okay to speak about love in politics or in, it's really not okay. It's a taboo. And so I talk about a lot how CARE could be easily detabooized, or I don't know how you say that, entabooized. So there's no word for that in English, I think. So anyhow, that is what we worked. So the equation you see in white, or perhaps you don't see them, but they are equation linking basically the consumption to a behavior, and that is the remodeling of the homo economicus and the utility function of economics. So the first consumption to self-interested behavior is the classic economic utility function you find in all the textbooks, right? But all the others do not exist yet. All the other utility function and equation do not exist. The meaning, the modern economic models we are basing our whole economy and macroeconomy on don't know that sometimes we can have CARE activated, and then if that is activated, you have a totally different utility function predicting a totally different outcome. It's not self-interested behavior anymore, but prosocial behavior, right? And if you have affiliation, it is norm-conforming behavior mostly. Not all, there are also many behavior, but and power is another equation, right? That you will foster more competitive behavior. Achievement is excelling behavior. So you can go on and on and on, and you can rewrite utility function. The problem is that you have a very complex mathematical model to track now, because the context will determine which utility function will dominate, right? You don't have just one anymore. You have a context-dependent view on certain contextual niche in which a person is doing their decisions. And the utility function you have to plug in is dependent on the context and the motivational system being activated. And that's something which is really difficult to track mathematically. And this is probably the reason why it has not been out there yet. So whenever I was talking in front of macroeconomists, they were like, yeah, we should do that, but it's really complicated. And then there might also be other, motivational system which prevent them to really change this model towards a more, human-centered model. So what we did to persuade, the first experiments I did was in the lab with Dennis Knorr, the macroeconomist, was to see whether we could at least prove for economists that we had something here and that you can change preferences through priming. So we looked at ways in the lab to prime the CARE motivation system and then the same person power in the next hour, and then to prove whether really another decision will come out, whether the same person can be brought to be very prosocial 1 hour when the CARE system was activated, and the very same person then punish and compete just because power motivation was activated without them knowing. That was a priming technique. So if you ask yourself, how do we do that? I have a little video. You tell, where is it here? So we told them, you will do first, a lot of game theoretical, financial, monetary decision games, but then you will have a second experiment where you'll have to interact with puppies because that's a stress reduction thing we do with students. And so you can already think of how you want to enter the room and so on. So they saw these videos of puppies. We know puppies are reducing, and they're like, so anyhow, that when you see enough long these videos, you get this CARE system and this, affiliation choosing system, you get that activated. So just for a moment, right? But enough so that they were activated and we could use these lots of, economic games to prime them. And then with power, you just say, in the second experiment, you will be basically the boss, and you will have lots of students, and you will have to tell them what to do. So think already what you will, your strategies and so on. You will be the boss. So easy, right? So you prime that, and then you do all these games. Economists know, right? They accept these games. It's like game theoretical paradigms. And you see that if you prime CARE, you have more prosocial behavior going on these games with financial rewards. And if you prime power, you have more, these altruistic punishment and competitive behaviors. So we did several of these experiments, and it's really easy, right, to show how you can just switch motivational system and then have the same person showing totally different financial behavior. And that shows really that actually these preferences are not fixed, they're not context-insensitive, and that, people are not just one-lined, self-interested, and that's it, right? But what we now wanted to know is, we know also that you can activate the CARE system through massage or through oxytocin nasal spray, but this is not very helpful to work towards a caring society, right? You would say, I can't give you oxytocin before you do, and every day and so on. So it doesn't help also long. So what we were much more interested is, can we use education, mental training, self-education, and intention setting, conscious decision-making of people to actually move towards more care in our society? And is that feasible, right? Because of course you can change institutional design. That's the speciality of economists, of politicians, of legal bodies. But I'm a psychologist, right? So I couldn't do that, not so easily. So I'm not saying that we'll have societal and system change only by changing ourselves. That would be naive. We need to change ourselves in accordance with a congruent institutional design, which is congruent to CARE, right? Because if you have an institutional design which is only fostering achievement and competition, you will never be congruent with, you can be as caring person, you will just be beaten up all the time. So there needs to be shifts in both, but I'm talking about what can we do every day without waiting for the politician to wake up, right? So I have two studies. The first study was really like a very big scientific heavy based study to persuade the world that this is possible. And we started a long time ago, 2008, in a time where nobody had done this, right? Like induce and cultivate compassion and so on. And then I'll switch to CovSocial, which is a pandemic, a very recent study where we try to see whether this very heavy scientific study can be now translated into scalable approaches, virtual, for a bigger mass, right? And really bring about into education, society, and so on. So already before the pandemic, when I started the resource project, the big concern were already things we see now exacerbated in a maximum way, right? We had already loneliness problems. Subjective loneliness was increasing, depression, stress, poverty in the midst of plenty. I have to say, I wasn't in California for 6 years, so I have a very fresh look. And I was appalled to see so many poverty in San Francisco, sleeping on the street in tents in the middle of so much richness, right? I was really suffered because I had not seen that 6 years ago. So it really stunned me, and I was like, wow, right? And also in Europe, the polarization is increasing extremely between pockets and people. We have a war, and so there is a huge amount of problems everywhere. And the poverty in the midst of plenty, the climate crisis, obviously. So what can we do, right? What can we put positive, because we can't just give up, right? And so we really wanted to know, can we move people towards becoming global citizen, responsible, global compassion, like not just stress reduction, which is also one outcome, but really improve mental health and global compassion and global cooperation and social skills. So this study was really long. It was the first, at that time there were mindfulness studies, but 8 weeks. And we really brought it into 9 months. And at that time, this was quite daring because nobody knew what people really do, 9 months of mental training every day. And why we did a long study was because we wanted to know, okay, attention-based mindfulness was out already, MBSR programs of John Kabat-Zinn. There was some research, but the scientists focused a lot on the attention component, on, focusing your mind, attention. But if you look at these very old Buddhist texts or whatever, it's all about compassion, actually. So I'm an empathy compassion researcher. So I was like, we need to enter. And that was in that time, the self-compassion, and it was just coming up, right? All these compassion movement was not so much out there yet. So we added this 3 months compassion care module where people were training every day, opening their hearts through gratitude, through acceptance of difficult emotions, through loving kindness practice, through compassion practice. So this is why it's red, because it's opening the heart. It's really like a heart module. And then this is still very new module that has not been really, used as an 8-week program yet, is what Buddhists would perhaps call the wisdom component. There's always 2 wings to compassion. One is the heart, the motivation, and the other is the ability of wisdom, of reflectivity, and of intelligence, and of perspective taking. And so and I will tell you more about why this cognitive perspective taking is so important for global compassion and for peace, because the care system alone is not enough from how we got it from evolution. It's very in-group based, but it's not in the moment where you have an out-group or people you don't like or another nation, it's a bit more difficult to expand your circle of compassion. So this perspective taking is needed. And what we did is we trained 17 meditation teachers in this very secular program. And we had an app where every day, so we had these retreats where people, this was before COVID, like 80 people would come together and meditate in a huge room and learn the practice of each module with the teachers. And then they would go into their 3 months module and would do through the app these 2 core exercises every day. And once a week, they would come together, 20 people, like in a course with the teachers, right? So it was quite intensive. It was like really a big program. And then we had 90 different measures. So before, after each 3 module, we had 90 different measures. So, and we had in this more affective, compassion-based, we had this loving kindness meditation. And then we had this diet. And I will talk a lot today about this dyadic exercise because I'm very, very passionate and excited of the effect it has. It's a partner-based 12 minutes loud meditation, you could say, but it's very different than a mindfulness alone meditation. And I show you a lot of data because I was really like tuning in lately more and more on the effects of this exercise. And then we had a perspective-taking diet, which was really, it was made for learning how to take this cognitive perspective of what is the other person's thinking, believing, what do they have for beliefs? Why do they acting like that? They have to have very strange beliefs if they act like that, right? So, and we were training that with an IFS, it's an internal family system, is a therapeutical approach of Dick Schwartz developed here in America. But we also had a neuroscientific backbone for the division. So it was not just like intuitive, but it was because we knew from neuroscience for many years that there are different pathways in the brain underlying these different social motivations or social emotion and the perspective taking. And so I'm just now dissecting this social brain for you so that you learn about these differentiation, because I think it's really important, right? We moved so much, away from just empathy being everything about the other, right? Just like, okay, empathy is whenever I understand the other. No, it's much more refined now, the picture. So empathy, we started off very early, 2003 in London. I had these couples in the scanner and they would all get pain. And what we saw again and again, and there's like hundreds of different studies on empathy now, is these what we call shared networks. So a part of the network processing your own pain gets reactivated, you could say, if you see the other being in pain. And there's a lot to say about which part, right? I'm making a complex story very simple. It's usually the core network of this anterior insular and ACC. It's like two nodes in the brain, which are correlated to high arousal, negative affect, alerting. And it's very consistently activated if you are empathizing, sharing the suffering or negative emotion of others or pain, right? So we call it now, just for the sake of simplicity, the empathy for pain network, right? But there is not, empathy is also for joy. You can have empathic joy and, be resonating with the joy of another. It doesn't have to be pain. And that's the difference to compassion, which I'll come later. Compassion is always about the suffering of the other. Empathy can be about the joy or the disgust or the pleasant touch. You're just sharing whatever the other is feeling. But at the same time, it's not you. It's not emotion contagion. So the other is the source of my suffering now. It's just vicariously I'm suffering with, but it's not me, right? It's not my emotion. So now the next phase, it was early days in empathy research, was that we understood how fragile empathy is. That it's not just an on and off response, and Jamil has done a lot of work on regulating empathy. So we call it the fragility of empathy. The first empathy paper in neuroscience which came out was 2004 in Science. And then these modulation came, that was a Nature paper in 2006, 2 years later, where we wanted to understand what are the factors which are actually making empathy so fragile. Because if we would all be hardwired for empathy, we should be nicer to each other, right? I mean, why do we do humanize? Why do we do in-group, out-group bullshit? I mean, why is it so quick, right? Why do we do all that to each other? Because it's very fragile. In the moment you think you are self-righteous and this person is bad or is an out-group member or not from your nationality or not your skin color or whatever, you have an out-group bias. And we could measure that in the brain. So, after having scanned couple, we put, people on the left or right side, which were either like, a football fan from your football club, or it was said that this was a football person from your rival football club. You have also that in rugby and different, we had like Zurich, Basel and Zurich, they hate each other, right? And so it was so easy. And then, the empathic brain signal in the anterior insula I showed you was just like 1 minute you thought this is your guy, right? You're from fan club. suffering pain, you had all the empathy of the world. And the next minute you thought this is the guy from the Basel football club, and there was no empathic signal in the same brain working fine. And instead of that, you had another signal, which we called Schadenfreude, right? Schadenfreude is a German word, but it's the shameful joy if someone else is suffering and you're laughing, right? Like the penguin here. And we could measure that in the brain. There was a reward signal that the other one getting zapped, and you were feeling positive and revengeful about it, and like, yeah, right? And we could do that in the lab, and we were like, my God, empathy is wonderful and is necessary glue for humanity, but it's fragile. It can very quickly be modulated because you think someone is unfair before, or there are many, many modulatory factors, lots of wonderful studies out there also from Jamil showing which factor modulating empathic signal. And then another very deep understanding I had from, is what is it actually what we want to train? Is it empathy or something else? Or is it both? Or is it how to move from one to the other? Was that I understood the difference between empathy and compassion. And boy, I really didn't understand it when I set out. It was, in early days doing empathy brain studies. And then I thought we have to train everyone in empathy, right? Because empathy is just this good thing. And so I became a plasticity researcher in the sense that it's about training now, about changing the brain, about malleability. And when you start doing empathy, plasticity research, you need first to find the experts. You need to find the experts who have done thousands of hours of empathy or compassion. And that is what I was looking for. And I happened to be part of the Mind and Life Institute at the time, which is a dialogue between the Dalai Lama and a lot of Western, scientists. And so in one of these conferences, I also met Mathieu Ricard, who is the French monk here below, and he was a scientist himself, right? And so he was a microbiologist in his former life, and then he thought, oh, these scientists, they are also unhappy and never happy. They are super intelligent, but I want to become a happy person. So he went to become a Buddhist with huge, big compassion master. And he learned this meditation technique and practice many, many decades. And then he came back into our scanner, which was fabulous because given that he was a scientist, he knew what we needed. So I could ask him to modulate, go in states of 30% disgust and 90% joy and 50%, compassion, and he would do it. I mean, ask anyone else to do that, they would be like, are you totally crazy? I mean, how should I modulate emotions lying in a scanner? So, and then the important part of this discovery was that I had asked him to go in empathy, and what I meant by that is sharing the suffering of a BBC movie he had seen the night before of starving children in a Romanian orphanage. They were like autistic, like super thin. I mean, it was awful, this movie, and it was really the suffering of the world, these kids. And then I saw these reward networks, these CCARE affiliation, positive emotion network lighting up. And I was like, what is going on? It's not suffering. Is he thinking about the cake he will eat? Is he thinking about something enjoyable? So I asked him, and he came out and he said, you asked me to go in compassion and to produce compassion. You didn't ask me to share the suffering with the other. So we had this dialogue. Then I understood that compassion is actually unconditional love, is this motivation, is more motivation than a feeling, it's not coming and going. It's like really wanting the welfare of the other. It's what I showed before, the care system, right? It's altruistically motivation system. It's not just an emotion. So we made lots of studies with students, and we developed this model with a lot of papers, supporting evidence that when you're confronted to the suffering and you're not mature, you usually feel empathy. And if you're not a psychopath, right, you have a healthy empathic response, and your empathic brain is activated, and you have this empathic response. Now, the the danger, and that's what Mathieu suffered in the scanner when I asked him to go only in empathy and not do compassion. I said, don't do what you have trained. You just empathize with these children in the suffering as if it would be yours. He was like showing this huge empathy for pain network, but he told me from the scanner, I'm burning out. I'm totally burning out of too much empathic distress. It's unbearable. Can you please make some compassion blocks with me in the scanner, even though he had to come out actually. And he really begged me that we would do other ones so that he could come back into this loving, resilient, positive state again for his own sake. And so we really understood that the danger is that you can move into empathic distress. Batson in the 90s have called that already personal distress or empathic distress, which means it's all about you now because you basically got the trauma of the other. And now you think it's you, and you have not this healthy self-other distinction anymore. So it's all about regulating your own distress. And usually you get very withdrawal. You are not prosocial anymore. You're like, oh my God, let's leave me alone. I need my space here. So we are training people in these module, in these affective module, or also now in master classes, healthcare provider, how to move from a healthy empathic response when you have the danger to get into empathic distress, especially if you're in a hospital, it's stressed, it's pandemic time, you have no sleep, right? And you have huge trauma coming your way, yeah? Then it's very, very likely you will move into empathic distress. And if that is constantly, you will burn out. And you know the rates of burnout throughout the pandemic worldwide, right? The hospitals are empty from nurses because it just was too much for most. So how to teach medical doctors and healthcare provider to recognize empathy and then not become distant and cynical and you know, like close up, but go into compassion, which is actually a really healthy response for both the patient and you. And this is what we do in these you know, retreats and these modules. We are teaching people to move from empathy into compassion, and if they ended up in distress, into self-compassion first. Yeah, that's the whole chain. And then, you know, to complete the picture, why do we have this, you know, like the green module, the perspective module? Oh, it's because there is another route which is called perspective-taking route in the brain. And this route is really this ability to understand the perspective of another person, right? The beliefs and the thoughts. And so we have these different networks. The social brain is complex, so we can also train these networks, right? It's like in the sport club. If I have a machine which trains these more muscle, I will not expect my calf muscle to be, unfortunately, right? Like that will not make my calf muscle. So the same is true for the brain and for the multiple functions in the brain and in our mind. We have different mental exercise, meditation, mindfulness, compassion, and they will do different things. They will train different muscle. And we have evidence for that. So what I show you, after 3 months of attention-based mindfulness training, right? After 3 months of the presence module, we have and grows a gray matter increases like hardware in your brain in prefrontal areas and other areas too, which are actually correlated to an improvement in attention on an attention computer task. So the behavior is correlated to the growth of this gray matter volume in the brain. And in the same brain, 3 months later, when they do compassion-based exercise, you have other networks becoming thicker, which are usually like these paralimbic, limbic, insular, IFG network I showed you, relevant for empathy and compassion, right? And then that was interesting, this theory of mind or this cognitive perspective taking, this social intelligence could only be increased when you do this perspective diet every day. It could not be increased by doing a diet on compassion. It needed to be the specific perspective-taking diet with the specific question, the specific exercise to really improve that, and also to change networks like TPJ, which is a classic hub for theory of mind in the brain. So yeah, so in a way we can, right? It was amazing. I mean, this took 2 years to process, right? It's one slide, but it's a long time until you generate these pictures and these And so we were really like pleased, but it also showed it really matters what you practice, right? Depending on what you did and what you practiced 30 minutes every day, 3 months, you had different changes in behavior and brain, in subjective experience and so on. And now the diet, right? That was this little 12 minutes exercise they did in these social modules in the compassion-based perspective. And when you are doing it in a room with someone, you are like face to face, looking eye to eye. And one is just asking a certain question. For example, in the affect diet, the question would be, I don't have the question here, but what they practice. But so I just say a word here up, sorry. So the question would be, for example, Jamil, we are meeting every day. And every week I'm changing. So 1 week I will do affect diet with Jamil every day, 1 week with James, 1 week with you, right? And so the course will change. And I will be like, tell me a situation of the last 24 hours, because we meet every day, where you felt stress or difficult emotion, and how did it feel in your body? And then you have 2.5 minutes to reflect on that. I'm not allowed to say anything, not to ask anything, not to so. Just empathic listening, holding the space, be mindful, and there. And then 2.5 minutes gong, and now tell me a situation where you were thankful and had gratitude, and how did that feel in your body? So that's CARE system, is activating care, compassion, loving, gratitude. And then we switch roles. So we are totally democratic. And so, of course, I'm learning not to judge Jamil anymore, because I don't want that he's judging me when I'm doing my introspection, right? So, and because we are changing partner every week, very quickly I will also be like, oh my God, we all suffer, and we're all just humans, and we're just fragile, and because I perhaps a prejudice. I'm like, oh, now I'm like paired with this banker. Oh my God, and this will be hard, and I don't want, and so on. And then after a day or two, you're like, oh my God, he's such a cutie, and he's just so vulnerable, and it's just different, but it's just a person, right? So depending on the question you ask, the diets will be like a skill training. They will train different skills. The affect diet I just told you is training, interoceptive body awareness, accepting difficult emotion. The listener is empathic listening training, gratitude, social connectedness. So there is a lot of things which get trained in 12 minutes, right? So it's very efficient, but you have to do it every day over a long time. It's not just a one-off. And that makes these diets very different than a lot of inquiry method, from other groups, or like MBSR, where you do it in the course itself, only once, like take a partner and exchange about. So you do it every day, and that's the magic of it, even over weeks, because then you recognize pattern in your everyday life, because you change partner, this becomes a skill training, a real deep transformative skill training.
What's the retention rate?
How many people continue doing it? So in the resource project, it was amazing. We had less than 8% dropout, but that was, of course, a huge study with all other stuff and retreats and support. But that was amazing, right? And they really did it like 3 months and 3 months. I don't have the slide with the retention, but they did it equally often than meditation alone. But of course, they were in this super safe, very intense study with a lot of support. But I'll show you data on the CovSocial study, where we had Berliner who had never, ever done something like that in the middle of the pandemic, 10 weeks just online. And we still had a very high retention rate of more than 80% for a totally normal dividends in 10 weeks every day, right? So, and when I do that in masterclass with healthcare provider who have already done inner work and are therapists, the retention rate was like 99%. I mean, there was just one person not doing it the whole week, right? So, so it's pretty good, right? It's like really for such an intensive exercise. And that's data which really show that when we ask how close do you feel to the other person before and after through these rings, you see that independent of whether they did a more cognitive, complicated diet, like the perspective taking is a bit more complicated, or this more affective diet, they felt closer to the other after doing it. Everyone, like on average, no? But and what is also incredibly, we asked how much personal disclosure. And from week to week, they showed more and more vulnerability and trust. and shared more and more deep and personal and intimate stuff. And qualitatively, because I've followed hundreds of people now through these diets, it is so touching to see how they report how intimate they experience these 12 little minutes after the first week is bumpy. It's like something new in your life every day, shyness. But once you are over that, it gets addictive almost. And a lot of people wants to continue. So for example, in the last study, half of the course always wanted to have access to the app and continue doing diets. Just finished the masterclass, same thing. So because it really is super, it's just someone listening to you, non-judgmental, and then you listening to the other, and then you have this empathic gratitude joy at the end where you really like just cheer up by just listening that the other is in joy. So it's a rewarding thing, right, also. So yeah, that was something, people said, you are crazy, everyday diet with people they don't know. They are all very busy people. It's not like kids. They are like, 45 on average in busy lives, so on. But it worked. So, and that was also a research finding I thought was impressive. We measured social hormonal stress reduction. And so we needed to run a very nasty social stressor task where you have to give a job talk in front of people with white shirts who are not nice at all to you. They, instead, of laughing and being responsive like you guys are, they are like, yeah, and so that brings cortisol up, and that's called the social stressors. It's a social stressor, and the reason why you are socially stressed is mostly because you feel judged by others. You are not good enough. What is wrong with me? So it's not like stress because you are hungry or you are cold. It's a social stressor, but that's the reason for most of our Western stress-related diseases, and this is why it was so interesting to measure that. And what we found is that that's the control group, right? The people who didn't do anything. The mindfulness group did not reduce in social stress at all after 3 months. They had better attention, working memory, presence, all kind of good things, but not social stress on the hormonal axis. It needed the 2 modules where the diets were there every day to reduce this social stress on hormonal level to 51% of their first, so that was a big reduction in stress, but only if you do every day some diet, and it makes sense because you are really with a real person, and you could be judged every day because you are opening your heart and vulnerability, and you are not. So you make the experience, oh my God, and he's also not, and she's also not, oh my God, so why am I actually always afraid not to be good enough and not to, so this shared humanity and the sense of we are all just human beings and frail is coming along, and I think this is the explanation for this incredible effect, right? So that was something why we also wanted to grab deeper into the diet as a practice, right? And then perhaps just the last data set on the resource project, we showed that this economic behavior, these games and these financial games I showed you at the very beginning, only through compassion-based explicit 3 months training, you could really increase altruistic motivation in this behavior, in this economic relevant decision-making behavior. So to make a long story short, I mean, I showed you that you can really induce plasticity on all levels of subjective, of behavior, of brain, of stress, immune response. We have 90 different measures, but it really matters what you practice. We should not say anymore just mindfulness or just meditation or mental training, but what type, what format. That's very important that we get more differentiated when we really want to do that now, this work. And I could show you that it then really, really changes networks in the brain, which comes with behavior, like compassion increases. And that compassion is the golden. If you would ask me, which of the 3 modules should you do to have maximum output, I would say compassion, because that was actually efficient on many, many ways. And just to, bring you back to the origin, you can really, cultivate care as an attitude towards life, not just priming it or some oxytocin or some massage, but you can really make people change their attitudes over longer duration and becoming more caring. And we have shown that now in this resource project with many, many, many papers, right? Which means you can really educate our children to become more caring global citizens, right? Which become more cooperative, where the brain wires differently. And that's really an important news, because it can shift the education we have from, just achievement, competition, and so on, to a more, caring, more other focused, more we focused, more social connected people, right? And this is our responsibility to do that, to bring spaces where we can teach that into school. And so this is, perhaps 5 minutes. Do I still have 5 minutes or no? Sure. I don't know.
The audience has answered.
Is it okay? Okay. So I do very quickly. So because I promised you this last CovSocial bit, that was really a study, which was mental health study in COVID time, going through these lockdowns and just wanting to know, what does these lockdowns do to our humanity, right? And this was just Berlin, so it's a little part of humanity, but I looked at a lot of other COVID studies coming out. They show similar patterns. So here we had 60,000 Berliner through the city register, and then, after they had to do 4 hours of questionnaires. And so we had only 4,000 at the end who really did all the, 4 hours. But it was a very, very heterogeneous, a very, very, representative sample of Berlin population. And then we had a first phase where we just descriptively followed them, and then this intervention phase. I'll come to it. So you can read, we had a brochure in English, it's downloadable for free. And there you can find all the measures, the social cohesion measure, the political measures, the resilience measure, the vulnerability measures, and have a better look on the totality of the measures we had and the study outcomes. But I just show you here one prototypical outcome, because it's almost for all our measures the same picture. So in January 20, right, that is before the first lockdown hit, you see on all this measure of depression, loneliness, anxiety, and stress, psychological vulnerability. The first lockdown come, you see the red curve going up. So psychological vulnerability going up. Then in June, there was a reopening. We could come out of our caves again. And the Germans thought, this is over. And everyone went into vacation and thought, that's over. We were a bit naive. And some people said, no, it's not over. It will take 3 years. But nobody wanted to hear that. And so you see it jumps back, not to the same level than before the pandemic, but it kind of recovers. And then came the second lockdown. I think you Americans were not in such a long lockdown like we. We were from October, November, December, January, February, March, April, in a non-stop lockdown in Berliner winter, which is not California. It's gray, it's cold, so that was a real challenge. And you see that there is a pandemic fatigue effect, right? Every month, vulnerability and mental health declining. And so you see in this lens, you see a clear effect that the same people in March 21 were much worse off than a year before in the same season, in the same lockdown, same people, same city. So you really, really saw after a year, they just were so worse off. And what we see again and again in all data, who suffered most? The women. They were the most vulnerable throughout the whole pandemic, and the younger. And that is a pattern I've seen now in many, many COVID studies. It's not those who had the higher risk of dying from the disease. It's the 80 to 25-year-old we tested here who were the loneliest, the most stressed, the most anxious, and most depressed. And already before the pandemic, actually. And I knew that because I did loneliness research, that the most subjective lonely generation nowadays is the youngest and not the 80 plus, right? We have a loneliness pandemic, really of enormous dimension, rolling up hours early. And you see that in emotional well-being, right? You see the women really having much more negative affect during the lockdowns, not when they are out, they're all positive, but it goes into the cellar in lockdown. And you see again that the youngest are most vulnerable, suffered most. So, and we see that across COVID studies, actually, we see this pattern. So it's really the question, we have to do something. We have a huge mental health problem here. And in our youngster, which have the most plastic brain and which need our help. So we started to say, okay, let's take the end of this longitudinal study and just offer them either 12 minutes mindfulness training, attention-based classic mindfulness here in yellow, or we offer them these 12 minutes affect diet, this partner exercise, right? And let's see, do we get them out of loneliness, of stress, and so on? That was the question. Everything online, just app-based, no retreat, no other things, very minimal, right? This is a scalable approach. Summarizing it, you can say, hey, yeah, you can actually really do that. You can, in 10 weeks, with just 12 minutes, just an app, really produce positive outcomes. Both interventions are somehow good. However, the diet does just more. So when it comes to, like really improving positive attitude and resilience and gratitude and care, and to bring people in social connectedness and out of loneliness and reconnecting with a social sense of humanity, then the diets are much more efficient, which makes sense because there is another being, right, every day. So this is why I'm doing these masterclass now with healthcare provider where we do retreat, like live retreats, and then 8 weeks in their hospitals and in their work relation, in their work environment, they do these 8-week diets with other people and train in their daily life to actually acquire these skills in the middle of their days and not just in some, because usually you come out blissful of a retreat, then you go back into your institutional setting and here you go, it's war on the workplace and you have forgotten about the whole bliss and the compassion. So these diets allow to bring this work into your everyday life a little bit, but over a long time, and really transform you in the systems you are working in. So this is why, and now I'm advising a company, and I will also meet the person here in Santa Cruz. It's called humanize.com, and it will bring this diet work on a large scale into the world, but in a very, very protected way. So the important thing is you cannot just, the questions are easy, but you cannot just go out and doing diet. You need to protect the space first. You need to have onboarding. You have to learn the do's and the don'ts. So you need a real diet teachers to onboard you basically through a course. If you don't do that, it will not work. And it can also become harmful because then people don't follow the rules and then it can be transgressive or not safe. And so it's really about the safe space. But once you have made sure that this is there, then it can be very deeply transformative. And I just came from a trauma conference where it was very, very clear that it's also a very good tool for trauma, because this is in trauma, the trust to other people and your relationships are wounded. And that's how you bring it back, right? While you reconnect to yourself and others. So that's just 2 books, which came out of these 2 conferences. And if you are more interested, about caring economics approach, you can find lots of other people speaking about caring economics approaches from politics, economics, different views in these books, and give you a broader perspective on different approaches. I just have one, of course, as a psychologist. So thank you. That's my new group in Berlin. And I thank you so much for your attention.